one of the things that you've said, I've heard you say this, I think you've said this on the show as well, that this is the first generation where Alzheimer's is optional, where, whether you're in your 30s, your 40s, your 50s, even maybe 60s and 70s as you are, that this is an optional disease for which, and we'll talk about this, as we get into it, there currently is no cure. So there's no, there's no therapy, there's no drug that we know of that can actually, and I'm using air quotes, cure the disease. So let's just start with expanding on why you believe that Alzheimer's is an optional disease.
Absolutely. So in the past, we had nothing that would reverse cognitive decline. And so we're careful to say this is not a cure for Alzheimer's. You need autopsy data for that. But what we can say, and what we have published, and it's freely available online, we had a clinical trial published last year. And before that, we had, as you know, many, many case studies that were published. What we can say is that we can reverse cognitive decline, especially early on. So when you develop Alzheimer's disease and get to dementia, you go through 4 phases. Phase 1, you are asymptomatic. You can already show, even sometimes in people in their 20s and 30s. And, we used to think of this as a disease of our 60s, 70s, 80s, 90s. We now know that it starts much earlier than that, but it's diagnosed later. So you can have a period where PET scans show abnormalities and where spinal fluid shows abnormalities. And actually, one of the biggest advancements, and this is a very exciting time, so much going on, is that there are now blood tests that all of us should have, just as we know our cholesterol and our LDL and things like that. We should know our p-tau 181 and we should know our A beta 42 to 40 ratio. These are telling us whether we're headed for Alzheimer's. So like never before, we can see it coming. Then this second phase, if you don't do anything at that time, if you don't get people on active prevention, and I argue everyone should be on active prevention at the age of 40, or if they're older, please start active prevention. Second phase is SCI, subjective cognitive impairment. And we see virtually all of those people reverse. They do very well. By definition, what that means is there's a problem, but you're still able to score within the normal range on cognitive testing. That lasts on average 10 years. So you have this wonderful window. So if everybody would get on active prevention or earliest reversals, there would be virtually no Alzheimer-related dementia, which is why I'm saying it's now for the first time optional. The third phase, if you don't do something earlier, is now MCI, mild cognitive impairment. And Dr. Estima, it's unfortunate that people named it mild cognitive impairment. It's like telling someone you've only got mildly metastatic cancer. It's a relatively late stage of Alzheimer's disease. And that each year, 5 to 10% of those people with MCI will convert to dementia. And the difference is with MCI, you have preserved activities of daily living, whereas with dementia, you do not. You begin to lose them. You're losing the ability to drive and balance your checkbook and figure out a tip, find the right word, interact with people, remember what you had for breakfast, learn to use a new phone. All those sorts of things are beginning to go. So the bottom line is you can do so much so early now, and we have markers for it, and we have definite improvement in people who are treated appropriately. So that's why I say this disease is now optional.